Hi, my name is Emily Banks, and this is my Sportsmed 3 Unit 4 project on the rehab for an ankle arthroscopy. Ankle arthroscopies, also known as keyhole ankle surgery, minimal invasive ankle surgery, and open ankle surgeries, are limited risk ankle surgeries that are done under general or regional anesthetic. It is where two small incisions are made into the ankle joint, one that allows for a camera known as an arthroscope, and the other that is used for the tools used by the surgeon to carry out the procedure. This is, as well, because of the small dimensions of the ankle joint, there is also the use of a pressurized fluid to circulate through the joint and able to create more room as well as clean out debris constantly while the surgeon is working. Here are some different examples of different perspectives in an ankle arthroscopy. On the top left, you can see both the incisions made as well as the tools in the ankle, and then throughout the rest of the photo you can see many examples from the perspective of the arthroscope camera inside the ankle joint. There are a variety of reasons why someone might need an ankle arthroscopy, and these reasons can include, but are not limited to, ankle arthritis and ankle impingement, both of which a surgeon can go in and remove the inflamed tissue that can be causing limited range of motion as well as pain for a patient. There's also ankle instability, which can often be caused by sprains and other sorts of injuries, and in an ankle arthroscopy the surgeon can go in and fix ligaments as well as tendons and other injuries. There's also pain following just general acute traumatic force as well as ankle fractures, and in an ankle arthroscopy a surgeon can see what could be causing the pain as well as how to fix it. There's also osteochondral deficits, specifically osteochondral lesion of the talus, OLT, which is when an ankle sprain or injury can damage the cartilage and the talus bone of the ankle ligament. There's also loose bodies, which is basically debris that can be causing irritation in the ankle joint, and synovitis, which is when the joint becomes inflamed from irritation and can be causing pain and general discomfort. As well, in this pie chart, you can see a series of other injuries as well as the research done by a certain hospital on how common certain injuries were to need arthroscopies and what arthroscopy patients typically have when receiving the surgery. Going into the main focus of this program, we will be focusing on the general rehab for an ankle arthroscopy. Typically, these will take about 4 months, but it kind of depends on what the surgery was for specifically, because as we saw in this previous slide, especially on the pie slice, we see that there wasn't just one specific surgery that outnumbered the rest, and although some have a majority, they're all pretty equal, and there's a whole bunch of different reasons why one can be getting the arthroscopy. Even so, they're all generally about the same in their program and their goals and what we're looking for to get back to an activity. For example, every single surgery will require PRICE, which is protection in the form of brace or wrap, rest, which is pretty obvious and staying off your feet and giving yourself time to heal, ICE, which helps with inflammation, compression, which will also help with inflammation, and elevation as well. For the first 1 to 2 weeks of your rehabilitation, the main goals will be focusing on your range of motion, a normal gait or a normal walk, and being able to put all weight onto your ankle/foot. In the beginning, though, we will want to stick with non-weight bearing stuff, especially for the first 7 days, which then we will start to slowly increase weight as tolerated. The ICE and elevation, as mentioned in PRICE earlier, will also be an important thing as needed to help relieve inflammation. ACE wrap will also help with inflammation and swelling as well, so that is an important thing that can also be done. Splints can also be used plenty of times and able to have that protection part of PRICE. Active range of movement can be done in this first week as well, especially with the hip and toes. Straight leg raises and short arc quadriceps are highly recommended, as well as stretching your lower extremities. Calf pumps and range of motion exercises, as well as band exercises, stationary bikes, and calf stretches will be super important to get towards that goal of being able to have more weight bearing towards the end of your week 2. For weeks 3 through 6, our main goals will be reaching full range of motion, as well as working towards having absolutely no pain during activities. So recommended exercises, as well as what we saw in that previous slides, we can start adding on to wall squats, double heel raises, step ups going forwards, backwards, and laterally. Proprioception will also start being put into use. Treadmill for walking both forwards and backwards. Elliptical trainers, which is what you see in the picture on the far right, as well as pool therapy, are all very helpful activities that can help depending on where you are at your stages in your rehab. For weeks 6 through 8, our goal is going to be mainly unrestricted ambulation without pain. So ambulation is basically the ability to walk without help. So being able to walk without help and without pain, that's going to be our primary focus. To do this, we will continue to be using previous exercises as well as adding on to things such as leg presses and hip sleds, which is what you see in the pictures, as well as the slide board, which is the more to the left photo on the bottom, which will help with moving laterally, as well as treadmill walking progression program, which you can get from most physical therapists as well as find online. Stairmasters can also be helpful, as well as continuing pool therapy in a more unrestricted manner. Lastly, for months 2 through 4, we will be progressing to running, agility drills, plyometrics, and more unrestricted movements. Physical therapy will be discontinued at this point, and the transition to home exercise could be given out at the end of that therapy, so you can continue to gain your total mobility back before you can return to your active lifestyle, which is our final goal. If you are in a sport, your physical therapist can as well probably be working on you with sport-specific exercises before you leave this program. That is all I have for my program. Thank you for watching.